right. It is 12 o'clock straight up, so we want to make sure that we're respectful of everyone's time. We appreciate you all joining us today for our first Community Behavioral Health Information Technology Coalition meeting. That's quite a mouthful, so sometimes you'll hear us referring to it as CBHIC, just our quick way of referring to all of that. So Lori, I'm going to remind you, yep, you're recording. We are going to record these, as you may have seen in the slides beforehand, just so everybody knows. And I think that at some point we'll have them available in case you want to go back and take a look. My name is John Glover. I'm a licensed clinical social worker and worked in private industry and as a psychotherapist for about 30 years before coming to Metastar. But since being here for about the past 4 years, I've been helping with the behavioral health efforts in quality improvement and really enjoying that. And being part of this team has been really great to sort of see the combination of health IT and behavioral health efforts and see if we can't work on getting behavioral health up to speed, because as everybody knows, we've sort of got left behind a little bit when the initial sort of layout occurred. So let me go over our agenda for today just quickly. What we're going to do whenever we have these groups is we're going to have some brief announcements, if there are any. We'll introduce everybody or have you introduce yourself quickly. And then we'll have a topic presentation. Hopefully in the future, it will be one of your clinics discussing an issue that you're struggling with or trying to resolve, both what you've done and any challenges or questions you might have for everybody else. But today, we're going to provide that example. And our topic today, of course, is options for reducing faxing. And Lynette Hesse, one of our project specialists, was so good to offer to write up an initial example and go through it for us so that we will have our first session to talk about. And then, like I said, hopefully in the future, we will have some other topics that you all can present. At the end of the presentation and discussion and everything, the Metastar group will have some additional resources to share that we will sort of pull together once we know what a topic is, and hopefully those help out when going forward. So let's get started. So in terms of announcements today, I really don't have any today, but I'm willing to open it up if anybody else has an announcement or something they're aware of that's going on that they think they'd like to make sure the group is aware of. Feel free to unmute yourself and let us know. So I'll give you a second there. If you want to put something in the chat, that's fine as well. So any announcements at this point?
John, this is Lori, and I just wanted to remind everyone, if maybe you joined a little bit late and missed it on the slides too, I just invite everyone to really turn on their camera as well, so that it's nice and interactive.
Yeah, thanks, Lori. And along those lines, we talked about this as well. We know that this is noon to 1 and probably a lot of people's lunch hour. So feel free to eat, have something to drink, do whatever you need to do. We know what's going on here, but we figure a lot of people didn't have other options for joining. So make sure you're doing what you need to do. All right, so next we're going to talk a little bit about this group's process and how it's going to work. The most important thing for everybody to be aware of is that, and we keep talking about this in our group, this is not a webinar. We're not going to provide a bunch of PowerPoint slides and a lot of, lesson information. This is more of a topic focused learning group. So we'll have one group or one person present on a topic, and it's not trying to be an expert in any way. It's simply, what are you doing? What's the information you have? And what are you curious about that the group might have some information on? Because we've talked with a lot of you all, And we're really impressed with what a lot of folks are doing and the information that's out there. And that was the point of bringing everybody together, was to have people share what they're doing to kind of resolve some of the issues that everyone is sort of dealing with. So it's a topic-focused learning group. At the end of the day, what we're going to do is we're going to actually have a quick poll before everybody goes to see what kind of topics you might be interested in the future. So we'll do that at the end of today's group. So in order to facilitate that, we also put together a little topic presentation form that you can fill out, and Lynette is going to show us what that looks like when she does her presentation today. I will remind people, even though I doubt there'll be a lot of reason or opportunity for this to happen, make sure that you do not include any protected health information when you're filling out the presentation form. All right, and if anybody is interested in sort of being a presenter and sharing something that you're doing in your clinic, whether it's a success or a challenge and something you'd like some feedback from the group on, feel free to reach out to us at Metastar and let us know so that we can set that up. All right, so I want to encourage you to join the conversation, and remember that we're really all here to learn together. And so it's participating together and hearing what everybody's experience is really what this is all about. All right, thanks for taking time to do that with me. What we want to do now is do some introductions and find out who is joining us today. It seems like we have quite a group. So I'm just going to run through my list, and what I'm going to ask you to do, because we've got a lot of people, just your name, your position, and your practice and location. Just something quick there would be really great. So like I said, I'm going to go through my list here and see. I've got first Lisa K. Would you mind unmuting and quickly introducing yourself?
Sure. Lisa K. Spurbeck. I'm a systems analyst for Brown County Health and Human Services. My emphasis is on the children, youth, and family side.
Thanks so much. Thanks for joining us. It's great to have you from Brown County. Mariana, I'm sorry, it's Marlana. Is that right? Marlana, you still?
Sorry, I'm doing double duty today. That's why my camera's not on, because I keep answering phones. I'm Marlena, and I'm from Taylor County Human Services.
Great. Thanks for coming, Marlena. And then I have Melissa.
I'm Melissa Kempfer. I am the mental health program manager at Church Health Services in Beaver Dam.
Great. Thanks, Melissa.
Yep.
Then I have Pamela.
Good afternoon. My name is Pam Hansen, and I am a director / psychotherapist for Positive Outlook Clinical Services in Milwaukee.
Thanks, Pam. A lot of people wearing a lot of hats these days. Sandra is next.
Hi, I'm Sandra Masker. I'm with Waukesha County Health and Human Services. I'm the Business Application Support Administrator, pretty much IT for Health and Human Services.
Great. Thanks for joining us, Sandra.
Thank you.
And then I have Scott.
Good afternoon. I'm Scott Brown. I'm a CFO at Orion Family Services. We provide outpatient and CCS services in Dane, Greene, Iowa, Jefferson, and a few other counties.
Great. Thanks, Scott. All right. Next, I have Sherry with a G, because I have two Sherrys. So Sherry with a G.
Hi, I'm Sherry Gorski. I'm the Health Information Manager at Rogers Behavioral Health in Oconomowoc.
Thanks, Sherry. Great to have you. Appreciate you joining us today. And then Sherry, looks like Stevens, maybe?
Hi, yes, I'm Sherry Stevens. I'm the Director of Office Operations at Pocket Center for Psychological Services. We're an outpatient mental health clinic in our biggest office is in Portage, Wisconsin.
Oh, great. Thanks. And then let's see, I got Taryn.
Yeah, I'm Taryn Pratt. I'm the health IT tech at Unified Community Services in Dodgeville and Lancaster.
Great. Thanks, Taryn. And Tom?
On the data administrator.
All right. Thanks, Tom. We had a little bit of trouble with your audio there. I'm going to run back up front because I think we have some folks that I did not get. Cheryl, I don't think I got you.
Hi, I'm Cheryl, and I am the CCS administrator for our 4-county region, Taylor, Price, Sawyer, and Iron counties.
Great. Thanks, Cheryl. Appreciate you joining.
I work with Marlena. She's our records release queen.
Oh, good. We have lots of different sort of positions represented here. This is great. Let's see, Fern, I don't think I got to you. So would you unmute and introduce yourself?
Sure. Hi, I'm Fern Conitz with Orion Family Services, and we serve about 10 counties in southern and southwestern and eastern Wisconsin. I'm psychotherapist and CQI manager with some IT support responsibilities as well.
Another person with lots of hats, right, Fern?
Yeah.
All right. Let's see. Jenny, I don't know that did I get you, Jenny?
Nope, I am Jenny Williman. I am our EMR coordinator out at the Brown County Community Treatment Center.
Great. Thanks, Jenny. Heather, did I get to you?
Nope, not yet.
Okay.
I'm Heather Carlson. I am the Behavioral Health Manager for Ozaukee County Human Services Department. And since Tom's audio went in and out, he is our database administrator at Ozaukee County. And
Great.
that is his therapy dog, Maverick.
That's not Tom, huh? Okay. All right. So I'm just trying to use my participant list here. I think I might have got everybody. Is there anyone, maybe Debbie? Did I get you, Debbie?
Hi, no, I just joined a little bit late. My name is Debbie Case. I am the Director of Revenue Cycle and Health Information at Rogers Behavioral Health.
Oh, thanks for joining us.
Yeah.
Nice to have you.
Nice to be here.
Anyone else that I didn't get to? My participant list kind of jumping around, so sometimes I may have missed someone. Anyone else?
Yep, John, this is Dan McWilliams with Crawford County Health and Human Services down in the southwest corner of the state.
Thanks, Dan. Appreciate you speaking up.
This is Marie Schrenkel from Washburn County Health and Human Services.
Thanks, Marie. Anyone else? Lots of great participation. Thanks so much, you guys, for bearing with us. It's so important for us to kind of get to know everybody who's participating. We also have our own Metastar staff on board. In addition to myself, of course, we have Lynette, who's going to be presenting for us today. Lori's running the Zoom for us and doing the slides at the beginning and all of that kind of stuff. Julie's going to be helping out in the chat. So if you have things to put in chat, she'll let us know about that. Kevin, of course, is with us and taking care of notes and that type of thing. And then Chris is supporting everybody and backing us up in case we have some need in one of those areas. So we appreciate you all being here today. The next thing on our agenda here is to go ahead with the topic presentation. So I'm going to tell you a little bit about that process and then let Lynette take it away. We'll have the presentation first, where we'll go over the form and some information that Lynette has about reducing faxing. We also want to have some time for questions. If you have some questions that come up when she's talking about this, then we want to have some clarifying questions. And then we'll open it up for discussion, and we'd like to hear what your experience with that particular issue may have been. If you have some other things that you've done to reduce faxing in your own organization that you would be willing to share with people, that would be great to hear about. Because like I said, we all want to kind of put our heads together and look at this issue. When we talked with folks, we found that this was something that everybody was kind of still doing. We're used to it, and we're kind of continue to do what we're used to. So it's an opportunity, a real opportunity to maybe change things up a little bit and move things forward. After the discussion, we'll do a little bit of summary, and then, like I said, we'll follow up with some resources that hopefully will be helpful to you. So with that, I'm going to turn it over to Lynette. Lynette, and maybe Lori, would you like to share the form while Lynette takes us through that?
Sure.
Well, good afternoon, everybody from very sunny Wisconsin. I'm kind of chuckling because I'm a certified telehealth expert, and the one thing we would tell our providers, and you guys might have to never do a telehealth appointment with the sunshine in your face, so I apologize for that. Can everybody hear me okay? Thumbs
Break
up.
up just a bit.
I am. Okay.
That's better.
All right, I'll lean in here and my face will be glowing. So I am going to tackle the first topic, presentation. And part of that was for us to be able to kind of walk through what the process would look for.
We lost you, Lynette.
You did?
Oh, there you came back.
Oh, that's too bad. Okay. I am going to try something real quick, Don. Do you want to tell 3 jokes quick?
Sure. So just quickly, while Lynette's sort of trying to work with her audio there, you can see the form, the template that we have up on the screen. And this is just to give you an idea of how simple it is. Asking whatever the topic is, describe the issue a little bit. What might be helpful about finding a solution to this issue, and then any actions that you've taken to try to resolve it, as well as any challenges or barriers you might have encountered while you were doing that. And then, of course, we have a section there for questions that you have for the group. If you'd like some feedback specifically about the topic, we want you to be able to put in some questions there that the group can sort of respond to and tell you what their experience has been, and if they've found any solutions or options for addressing it that maybe you hadn't come across. So it can be this simple is what we're trying to show, and we really don't want it to take a lot of your time at all. We just simply want to give an opportunity for you to say, hey, I'm working on this. This is what I'm doing, and here's some of the things I ran into. Has anybody else tried to do this? What can you help? What can you do to help? Okay. So Lynette, how are you?
Can you hear me now? No, that's too bad.
Try again.
Is that better or worse or the same?
It's okay.
Okay. Sorry about that. Technology is fun, isn't it? I guess that is a good place for me to start that. My background is I've been a project specialist with Metastar. I think I started in 2012. I took some time off, but my healthcare career dates back to 1991, I believe. So like John mentioned, really the idea for this is going to be straightforward and easy. So we have this template, this topic presentation template that we would, when we identify an issue or a topic, we just would fill out this form, and then it would be really straightforward. So we decided for this inaugural meeting to talk about fax reduction as a topic. One of the reasons we did that is many of you back in June or so, took our health IT maturity assessment. That was a 45-question survey that we actually was developed by Medistar. And we were able to flesh out some issues from that. And one thing we found out, just to throw some data at you, is over 75% of those 29 people surveyed continue to use faxing more than 25%. And really a third of those folks didn't have a plan to reduce faxing. Now we know faxing is still utilized a lot in the healthcare industry. And we're not saying you have to reduce faxing, but if you were looking at some opportunities, I wanted to bring forward one option that you may have available to you actually for free, and you may or may not know about. So why would you want to reduce faxing? Well, there's some national data that says in the healthcare world in the United States, annually, about 125 billion, that's billion with a B, is spent on faxing costs. Data also that is faxing, if you're on electronic health record, it's really hard to move that data from electronic health record into your EHR in a quick workflow opportunity. Another thing is it takes labor hours to get that fax into your EHR.
Lynette, I'm really sorry to interrupt you. Your audio is still in and out, and we have some comments in the chat that it's difficult to understand.
Oh, okay. Let me see if I can call in.
Now that's good when you lean forward like that.
Is it?
Yeah, that's really good.
I apologize. I had no problem with my audio yesterday, and I'm having audio problems.
See, now you're super soft again.
Okay.
Yeah, it might be best, Lynette, to just call in and see if that works. Let's just give her a minute. She's all set up because we talked about this a little bit in case we were having problems. We wanted to make sure we had some backup options for it. Just give Lynette a second to get connected.
Can you hear me now?
Oh, very well. Thank you.
Much better. Thank you.
Doesn't that just make you stressed out for me to be presenting and not have audio? So, and I love it because we're technology experts, right? But okay, I'm kind of going over the template or the topic presentation form. Just one second. I'm going to do one thing for my own self.
Yeah, there's a little bit of an echo, so if you could turn your speakers down.
Okay. Yeah, you had an echo for you and a really bad echo for me as well. So here we go. Fax reduction, like I mentioned, it was identified in our HIT maturity assessment tool. We know folks are spending time and money to do faxing. We have some national stats we can share with you on that. So that were some of the items that we had talked about in this presentation. All right, sorry about that. I'm having a tiny bit of trouble seeing. Lori, would you mind making the template a little bit bigger? And then once you do take a fax, I don't know about you guys, but we were talking about wearing multiple hats. And I'm a project specialist for Medistar, but in my spare time, I actually work at a private practice clinic. So we were taking time to take those EHR or those patient charts and then scan them using documentation management into the EHR. So we were really taking time and cost for running your fax machine. And have you ever had that situation where you really wanted one portion of the note and you got 32 pages printed out, and just a lot of waste? So we know faxing, although it's HIPAA secure and it can be cost effective, there's also a cost to run that. So today, one of the things I'm really hoping to flesh out is some opportunity to hear if your clinic or county has a plan to reduce faxing, what that plan might be. If any of you guys have looked into different opportunities, that would be awesome. But for those of you on the phone and your video on, can you raise your hand if you have an actual 2014 or later certified EHR? And out of the group, I see you, Dan. Okay, so if you have a 2015 certified EHR, or if you have an EHR where you have access to SureScripts, which is an e-prescribing tool, you actually have, for no charge, access to a product called Direct Trust Messaging. Direct Trust started in 2010. It's a nonprofit organization, and most people call it direct messaging. And in about 2014, this initiative by the federal government, CMS and Medicaid, had this portion called meaningful use. And at that time, they required you to do direct message. And then that kind of started the birth of secure electronic messaging. So Direct Trust is, like I said, been around a long time, and we're going to provide you resources with Direct Trust. I could tell you that they're actually a certified HISP, and they are provided through many EHRs and other opportunities. So really, one thing that we weren't sure if people knew, that if you had certain EHRs, you actually have access to Direct Trust. And how it really works in kind of layman terms is it provides the groundwork and the platform to exchange information like an email. So you will have an address, you'll use a format, and you'll send information. It's completely HIPAA compliant. The biggest difference is it's used through certain protocol that keeps it secure. So how would you know if you received or could give a direct message? Well, instead of using just any of your regular emails, you'd have to have a certified Direct Trust, or direct, we just call it for short, messaging service. And I know at the facility I work on part-time, we happen to use Practice Fusion and have for 13 years. Which in the beginning, that was a free EHR, and we're able to utilize Direct Trust for that application. So really, instead of asking for someone's fax number or their email address, you'd ask them if they had a direct message address. We're going to talk a little bit about that and how that's historically been a tiny bit of a challenge, is figuring out those addresses. Because Direct Trust basically works via another messaging format, which is called Health Information Service Provider, or you might hear the term HIS. And like I said, I'm really presenting that Direct Trust is a free opportunity to reduce faxing, and you may or may not already have access to it through an EHR or another system you're using. I'm going to provide the resources that tell you all about this as well. Also, if you happen to have a patient portal that you're using, chances are really high that that's being utilized through Direct Trust. So that's another opportunity. So that's a little bit about Direct Trust. Again, I have a ton of information that describes it. So really what I wanted to do was really talk about faxing and plan to reduce faxing, and just kind of get some input for the group. And I'm going to kind of walk through some of my questions. I'll walk through my questions for you, and then if you have any questions for me, we can entertain those as well. Before I move on to that, I was going to go ahead and tell you that one of the ways that you could find out if you had a Direct Trust email, account is direct. All direct emails have the exact same formatting, and that is they utilize kind of like I'm Lynette Elhesse at metastar.com. The structure for messages are the same as well, where it would be the username you pick, @, and following the @ always is the word direct, DIRECT dot. And then usually it's that HIS provider, so that could be your EHR you use, and then .com. Because one issue that has provided confusion is direct email addresses are a secure platform, but they can look like unsecured email addresses. So I wanted to point out that. All right, I want to open up to a few questions for you guys, but before I do that, and I'm sorry, since I added this iPhone component, I haven't been checking the chat. So are there any questions listed there right now, Julie?
No, Lynette, we had one comment that they found this topic very interesting and they need to drop off the call. So encourage anyone who has to drop off. We will send follow-up notes and resources. So just so you're aware that you'll get some follow-up information. Otherwise, no current questions in chat, but I'll keep looking.
All right, well, I am interested either by a show of hands physically or use the show hands at the bottom of the screen. Is there anybody out there right now that has ever or has thought or knows about direct messaging? For those of you, sorry to call you out, Dan, but since I work with you as a client, I guess I get to do that. But with your moving to your EHR, have you heard of or has anybody talked to you about secure messaging or direct messaging?
They haven't, and I just sent an email off to our EHR expert in the agency to figure out if we do have that option in our current version or the new version coming up.
Perfect. And like I mentioned, I keep mentioning, we have really great resources from Direct Trust. I had actually been working with them on a project about the time of the beginning of the pandemic. And we've been working really closely because one of the issues that I personally ran across when I was doing meaningful use for my practice in 2014, it was so interesting because we needed to send a direct message to another provider, really any provider we were collaborating with. And I picked up the telephone and started calling these small practices and asked them what their direct message was, what their, account or their address for their direct was. And honestly, I would get transferred because folks didn't even know they had that technology. And if they knew that technology, there really wasn't a point person to tell me what their direct address was. So one thing I think I'm going to make Chris Becker laugh, but years ago, he and I said that really we should start a new phone book for direct messaging addresses, because one of the challenges you'll find is that even if folks have that technology to accept a direct message, they might not know what their actual address is. I'm going to skip one of my questions because it was about looking for direct messaging addresses. That can always be a challenge. I would say that was 6 years ago, and direct messaging has really had an uptake. The pandemic has been another opportunity for it to be elevated because this is all around secure messaging of information. So again, this can be tied to a patient portal. Usually utilizes Direct Trust, direct messaging. You can have a platform right in your EHR if you're utilizing an EHR to actually exchange that information through Direct Trust. It also includes any attachments that you would put that on as well. And that's all HIPAA compliant, and I'll send that information with you as well.
Hey, Lynette, one thing to point out in the chat, Chris Becker did give an example of what a direct messaging address might look like if folks want to take a look at that.
Yep, that's exactly it. Your name at direct.yourmedicalgroup.com. Perfect. All right. Lori, can we go back to the form?
I'm sorry. I thought we wanted to. Okay. Just one moment.
No worries.
There we go. Meanwhile, Lynette, there is a question in the chat about what if you don't have an EHR? Are there some, or an EHR that does this? Is there any options that way?
That's a great question, and I'm really interested in fleshing this out because I knew when I picked this topic that a good portion of the folks we're working with and the people attending don't have an EHR. If you Google reduce faxing, you will get every solution in the world. And I did it 2 days ago, and I've already got an email and a phone call from a vendor. Yes, there are a plethora of options. I work with a practice locally that uses E.O. Johnson. E.O. Johnson provides their faxing printings, and then they have a fax to electronic HIPAA compliant solution. So there are many out there. I personally don't know of anything else that's free other than Direct Trust. So one of my questions is, what faxing solutions are folks thinking about or looking about, or has anybody else used another product that might take their incoming faxes and send them to a secure HIPAA compliant application or any outgoing faxes? Is anybody else using a product, and if so, is there a charge for that?
Lynette, there is a question in the chat as well. Is the address always an individual's name? And this, I'm sure it means the direct address. Is that always the person's name?
No, you get to choose. You can choose your name, or say you wanted to create just like a mailbox, like a lot of people use admin. So you could use a generic title. It would just have to be unique, just like an email address. So no, you don't have to use a specific, like you don't have to always, you wouldn't always use Lynette Hesse. You could create an account that was for admin or billing, or, but it would be specific to your HISPN practice. So yeah, that's a good question.
Yeah, and Chris also put some information in the chat as well.
Yeah, so are folks, okay, let me kind of go back to my question. Is anybody, so are folks still utilizing faxing and really not looking in the strategic planning to decrease that? Anybody want to speak toward that?
Church Health is kind of unique in the fact that we do, well, maybe not unique, I don't know everybody else's organizations that well, but we do, we have medical services, mental health, AODA, and dental, and we have one fax machine. So, you know, any faxing that's coming in is coming in through the one fax machine. So, I guess I've just always thought that it would be a big hassle to, you know, try to figure out a way to reduce that, because we can't have things going from dental into mental health, or, you know, things like that. So I don't know if that's something that's kind of unique to us, but the stuff that I know is specifically coming for mental health, if I've requested something, if it's paperwork that's coming back, I've been having people scan and email me the paperwork directly, so that then we don't have to, it doesn't have to come on the fax machine. Although I am still printing a lot and having to sign things and then scan them back in and, you know, re-upload them to the chart. So it's not perfect.
Yeah, that's for sure what a lot of folks are doing. How about some of you guys that work at the county level? Is there any opportunity for you to do information sharing without using faxing in a secure HIPAA compliant, which makes me want to put in my plug. We have a great resource at Metastar for our HIPAA compliance, and his name's Brad Trudell, and he was not able to be here today, but if any questions arise in that arena, he'd be happy to entertain those. So, but what else? How about counties? Are you guys able to securely exchange any information in lieu of faxing?
Hey, Lynette, Lisa Kay from Brown County would like to share what she's doing up in Brown County. That's what the chat says. I'm not putting you on the spot, Lisa.
Yep, got it. So I know that the pandemic forced us to push a lot of our faxing to electronic, folks working from home. And my understanding is that there was software that came with our MFDs that just enabled us to convert incoming faxes to electronic attachments and direct them to a single email, which of course ended up creating new shared email inboxes, but that has bought us some time. I know that our EHR avatar, Jenny, can probably speak more to it, but we've been wanting to look at a module called Care Connect Inbox, which is apparently much more adept at handling referrals and exchanges, but I can't really say a lot about that, and we didn't get to implement it this year. And we do have some areas where the external partners that they're working with are kind of a limited and consistent set, and we've been leveraging SharePoint there.
That's awesome. Thanks for sharing. And I don't believe you're the only avatar user on the phone, if memory serves me right. Yeah, you know, and I don't know if anybody else out there utilizes a local print server, or if any of your printers are owned by an outside company. In Northwest Wisconsin and kind of central Wisconsin, we have a service called E.O. Johnson. I don't know, the practice that I work at is also utilizing an application for them, but they are paying a small fee for it. I think they said it was $280 a year to take those faxes and put them into a HIPAA compliant application. And that, I believe, I'm not sure if that's per provider or not, because that's a single provider practice. But I know COVID hit, we have, you know, people have different strategic planning, and fax reduction's always on there, but, you know, sometimes it's also efficient. So anybody else have any strategic planning to reduce their faxing?
Hey, Lynette, this is Julie again. In the chat, Tom wrote in that Ozaukee County is, they have an incoming fax drop to a secure network folder as a PDF. And he is saying their MFP allows for print to fax capability. I don't know if he wants to talk more about that. I don't want to speak for you, Tom.
Hi, thank you. Yeah, our machines that Ozaukee County have always been, you know, the big giant.
Having a real difficult time hearing you. I'm sorry to interrupt.
For incoming faxes. I had my hand covered. So most of our machines, the multifunction printer fax copying machines, they allow for network dropping of all incoming faxes. So instead of printing them, they actually get converted into a PDF and put onto a network folder. And then if your IT department can set it up, most of the printing capabilities can go directly to a fax number. So instead of printing to the big MFP, you're actually going to use the fax capability of the MFP to send a fax out electronically from their workstations.
That's great. Thanks for sharing. Are your printers all the same brand, or do you rent your printers, or how did you come about that application?
I've had a push to go paperless ever since I started with Ozaukee County, 12, 13 years ago. And so most of the MFPs are leased. from one of the local vendors. And so, anytime something gets upgraded, we make sure that those machines have the same capability. So the setup really comes on to the network end to make sure that the folders are available. And then most of the MFPs that come in have the same capability of being able to, dump to a network folder, or if they wanted to, it can be scanned to be sent directly to an email or personal folders for individual workers.
That's awesome. Do you have a charge from that MFP group? Do you know?
No, because you're just purchasing the equipment.
Okay, and that has that capability innate. Okay, perfect.
Hey, Lynette, this is Julie again. I'm going to call on Marie. She has some great information in the chat to share. She says she's doing a similar option as Brown County, but do you mind sharing, Marie?
Yeah, so we just got set up with a new printer system, badge security and everything. But that system does allow us to, all the emails or all the faxes come into our email to our admin assistant and then just gets distributed from there. So it comes in as a PDF, but then it also allows us to email out. So even if it's a Word document or whatever, you send it as an attachment on the email. So we're not having to do all that printing and scanning and all of that. So it's like at eGoldFax, I think. I don't know, I've used it like 3 times, so not an expert. But that's where we're at.
Thanks, Marie. That's awesome. You're close to me, geographically, but it's not E.O. Johnson. It's a different product.
Yep, we used to have E.O. Johnson. We just switched our contract over to Marco.
Okay.
Yeah, Marco.
We're always vendor agnostic, but I mean, we're here to share a great platform to share simple solutions. So I called out and would like to call out a few vendors occasionally. So great, thanks for sharing.
Yeah, Lynette, we're probably going to need to move on. Boy, don't you wish we had more time, right? Because it sounds like there's a lot of great information, and that's exactly why we got this group together. So really appreciate everybody kind of, talking a little bit about what you're doing and sharing with everybody else. We need to move on at this point, but boy, I'm really encouraged, to have this group talk about other topics at our next meetings. So Lynette, would you mind walking us through the resources quickly before we tie things up at the end today?
Sure. I'm actually just going to show the screens real quick because these are all information that you're going to receive in an email from Direct Trust, but it has that nice cause statement on this first page, talks about just different costs for faxing. You can go to the next one. And then here's a pro again. So I love the way they call faxing retro and direct messaging modern. So next slide, please. And then again, this is information about how Direct Trust works as well as their email address. And then the last slide is just a real simple, here's frequently asked questions. And now the last slide is just a real quick, really the change is simple. Instead of asking for people's fax numbers, you can ask for their direct messaging address and make that move over. So again, these will be included in your packet email that you're going to get to us and have the information. So thanks for your time, and I apologize again for the technical difficulty.
That's great. Thanks a lot, Lynette. This is really what we were hoping. I guess more time is the only thing we would hope to have, and we all hope to have more of that on almost everything we're doing, right? So part of what else we want to do today is get some feedback from you about what other topics might be really interesting to you. So Lori, would you mind pulling up the poll? We want to do this real quickly. If you would, I think we're going to ask people to pick their top 3. Is that right, Lori?
Correct.
So if you would, pick your top 3 topics that you're most interested in discussing. And then I think we also have an other at the bottom. If you choose other, we're going to ask that you please put that topic in the chat so we'll know what that is. So just take a moment for us real quick. Take a look at this, pick your top 3. We're really open to any other comments. And like I said, put that in the chat for us if there's something not on this list, because we're just trying to generate some ideas for you.
All right, Jen, it's looking as though we've got quite a few participants here, so I'm going to wait just one more moment if someone's reading through this. I also noticed that in the chat, another topic was digital signatures.
Yeah.
It looks like
had a lot of discussions about that, right, Lori?
Absolutely.
Yeah.
Absolutely.
With our virtual world now, that seems to be an ongoing topic for folks, the question of how to get signatures. So, you know, for sure, we will we'll definitely consider that as something that might be important to address.
And I just went ahead and closed the topic or the poll here, and I'll share the results with everyone. Everyone should be able to see this. And John, it's looking as though 2 bubbled to the top, telehealth group therapy privacy considerations, as well as the effective patient portal use during COVID and beyond. Followed up by 3rd, each of those received 10 votes. And then the 3rd was EHR implementation and optimization tips and tricks.
Okay, great. You know, we just want to thank you all for taking time to do this and help us get some direction. Hopefully, if we pick some of these top ones, one of the practices out there, you'll be willing to kind of tell us a little bit about what you're doing and ask some questions to the group that might be helpful to you in your efforts. And of course, we'll keep in mind the digital signature one that was added. Let's see, I think there's one other topic was added.
Yeah.
Also e-prescribing, John.
Okay, great. So once again, thank you so much, everybody, for helping us out with this. I think we, of course, want to be respectful of your time. So we're trying real hard not to run into your next appointment and maybe give you a couple of minutes to transition. I want to thank Lynette for making an example for us, showing the form and how it could be used. So hopefully you can see how simple it is. We really, like I said, we don't want you to think about having to take a lot of time. Just jot some bullets down and tell people kind of what you're doing and then ask some questions. So our next session, we're planning on doing these every other month. Our next session is going to be January 19th. We know we got a couple of holidays, big holidays in there, so you'll be hearing from us in emails and that type of thing to remind you. We really appreciate those of you who joined us, who are not necessarily participating in the effort, but you know, wanted to join the conversation. That's really great. That was the reason to keep this group open to anyone and everyone. So we thank you for coming. Please let us know if you're willing to talk a little bit about one of these topics and what you've been doing, especially if you have some questions that you'd like some feedback from the group on. That might be a good reason to do a brief presentation and get some feedback. Okay, everybody. Again, thanks so much for coming. Stay safe, and thank you for all that you're doing. You're doing such great work, and we really appreciate it. You guys take care.
And I believe we're emailing out the recording. Is that correct?
Sorry, yes, all
Yep.
participants will receive that after, as part
Okay.
of the main communication that comes out, along with all the resources. Thank you.
Okay, great. Thank you very much. Well done.
Thanks, Fern.
Bye.
Bye-bye.
Bye.